Hello everyone, and welcome back to the channel. Today, we're diving into a topic that affects millions of people worldwide, often without them even knowing it: fatty liver disease. Now, your liver is an absolute powerhouse. Think of it as one of the hardest working organs in your body. It detoxifies harmful substances, helps you digest your food, and stores energy for when you need it most. But here's the catch. When too much fat builds up in the liver, it can set the stage for serious health problems down the road. In this video, I'm going to walk you through 10 common signs of fatty liver disease, especially those early, subtle warning signs that people tend to overlook. So make sure you stick around until the end, because many of these symptoms are easy to dismiss, but incredibly important to recognize. Before we get started, a quick but important disclaimer. This video is created for awareness and educational purposes only. It is not intended to diagnose, treat, or replace professional medical advice. If you're experiencing any of these symptoms or have concerns about your health, please consult a qualified healthcare professional. So, what exactly is fatty liver disease? It's pretty much what it sounds like: a condition where excess fat accumulates in your liver cells. There are two main types. The first is non-alcoholic fatty liver disease, or NAFLD for short. This one isn't related to alcohol consumption. The second is alcohol-related fatty liver disease, which, as the name suggests, is linked to heavy alcohol use. One of the trickiest things about this condition is that in its early stages, it often causes no pain at all. That's why it's frequently called a silent condition. But silent doesn't mean harmless. Let's get into the 10 signs you really should know. First up, at number 1, is constant fatigue. This is one of the most common symptoms reported. We're not talking about just feeling a little tired after a long day. This is an ongoing, persistent exhaustion that doesn't seem to go away, even after a full night of sleep. If you feel completely drained for no apparent reason, it could be a sign that your liver isn't functioning at 100%. Number 2, discomfort in the upper right abdomen. Some people experience a dull ache or a feeling of pressure right under their rib cage on the right side. That's where your liver is located. It's typically not a sharp, stabbing pain, but more of a persistent, nagging discomfort that you might notice from time to time. Moving on to number 3, unexplained weight gain. Fatty liver disease is often associated with gaining weight, particularly around the abdomen. This isn't just about eating too much. It can be linked to insulin resistance and other metabolic changes happening inside your body that make it easier to store fat, especially in that midsection. At number 4, we have a loss of appetite. You might notice that you just don't feel hungry as often as you used to, or when you do eat, you feel full very quickly. This can be a subtle sign that your liver is under stress and isn't processing nutrients as efficiently as it should. Number 5 is nausea, or general digestive discomfort. This can show up as mild, occasional nausea, bloating, or indigestion. Since the liver plays such a crucial role in digestion and breaking down fats, it makes sense that when it's struggling, your digestive system might feel a bit off. Next, at number 6, is brain fog, or poor concentration. Have you ever had those days where you just can't focus? You might have trouble with your memory, or feel mentally fatigued. This is often called brain fog, and it can be linked to a buildup of toxins in your body when your liver isn't filtering them out properly. Number 7 is a feeling of general weakness or malaise. This is more than just feeling tired. It's a sense of being physically weak or just generally unwell, even when you don't have a cold or flu. It's a non-specific symptom, but it can definitely be an early indicator of liver stress. At number 8, we have the darkening of skin folds. You might notice dark, velvety patches of skin, especially in areas like your neck, armpits, or elbows. This condition is called acanthosis nigricans, and it's often linked to insulin resistance, which is a major risk factor for developing fatty liver disease. Number 9 is something you wouldn't notice on your own: Elevated liver enzymes. For many people, fatty liver disease is first discovered during a routine blood test. Your doctor might notice that your liver enzymes, like ALT and AST, are higher than normal. This can happen even when you have no other noticeable symptoms at all. And finally, number 10, an enlarged liver. In some cases, a doctor might be able to feel that your liver is enlarged during a physical exam. More often, it's detected through imaging tests, like an ultrasound. This is a clear physical sign that there's inflammation or fat accumulation going on. Now, it's really important to understand that if left untreated, fatty liver disease can progress to much more serious conditions, like liver inflammation, which is called steatohepatitis, and eventually scarring, known as cirrhosis. But here's the good news. The early stages of fatty liver disease are often reversible. Making positive changes to your lifestyle, like improving your diet and getting more exercise, can make a world of difference. So, when should you talk to a healthcare professional? If you have persistent and unexplained fatigue, or that abdominal discomfort we talked about. If you have known risk factors, like obesity, type 2 diabetes, or high cholesterol. Or if you've had abnormal liver test results in the past. Getting an early evaluation is key and can make a huge difference in your long-term health. Fatty liver disease is far more common than many people realize. And simply knowing these warning signs is the first, most powerful step toward prevention and better health. If you found this video helpful and informative, please give it a thumbs up. Share it with someone who might need to see it. And don't forget to subscribe for more health content. Let me know in the comments if you'd like to see a follow-up video on prevention, diagnosis, or the best lifestyle tips for a healthy liver. Thank you so much for watching, and as always, take care of your health.